My name is Michael Carter, and welcome back to another edition of EyeWonder. Today, Dr. Lee, I wonder, what is papilledema?
That's an excellent question, Michael. Papilledema is swelling, which we call edema in medical jargon, of the papilla, and the papilla is like a nipple, but it's inside your eye. And so, if you recall from the cross-sectional diagram of the eye, the light comes into the front of the eye, which is the cornea. It's got to pass by the lens, and then it hits your retina, and that signal is transmitted down the optic nerve. The connecting point between the optic nerve and the eyeball itself is called the optic nerve head. And if we have swelling, edema, in this optic nerve head, when we dilate your eyes in the eye clinic and look in there, we can see that swelling. And that swelling is called papilledema when the edema, the swelling, is due to increased intracranial pressure. So you have high pressure in your head, intracranial, and when that pressure is high, it's transmitted down the eye nerve sheath and can cause swelling of the optic nerve. The reason it's important is we're going to try and find out what the cause of the increased intracranial pressure is. And so that means we're going to do a scan of the head, make sure it's not a brain tumor or infection or inflammation, and then we're going to measure the pressure with a spinal tap. If the spinal fluid is clear, the pressure is high, and there's no tumor, we call that pseudotumor cerebri, which in my clinic is the most common cause of papilledema.
All right, thank you, Dr. Lee. That makes a lot of sense.
You're welcome, Michael.